Hello again. I'm sorry we had a technical problem. As I was mentioned to you today, we have a very interesting case of with a pancreatic tumor. So we have two problems in this patient. This is a 36 years old woman. So the first problem is that this patient is immunocompromised patient that developed lymphoma, pancreatic lymphoma. So it's a very big mass that is occluding not just the main pancreatic duct, also the biliary tract. What is the situation with this patient? So this patient um needs a treatment with chemotherapy, sometimes radiotherapy. Will depend on the results of the histopathology. But these patients could uh, solve this problem just with the treatment performed by the oncologist. So how we need to deal with this kind of cases? So we have two problems. The first one, the biliary tract is occluded, and the second one, the pancreatic duct is occluded. So we need to decompress both ducts. So now you can see in the ERCP, we have the cannulation of the pancreatic duct, and we have the cannulation of also of the biliary tract. So I am using uh, today an sphincterotomy from and a guide wire from GTech Medical Supply. So it's a very good guide wire. You see the sphincterotomy is interesting because we have a covered part until the middle, and this helps to prevent damage of other tissues or when we have difficult position when we need to perform the sphincterotomy. So I will start with to do my sphincterotomy, then I will come back. So what should be my strategy? I will show you today a new technology. This is a new stent that is uh, now available in some countries in Latin America and Ecuador also. This is a biodegradable stent. The name is Archimedes. I will use this stent in this case for decompress the pancreatic duct. Why? Because it's a biodegradable, and after the treatment that the patient receive, I don't need to come back to retire the stent. Second, I think it's a very interesting case to apply this kind of technology. And in the second step, we need to see how we will decompress the biliary tract, okay? So for the moment, I am doing my sphincterotomy. So it's a big tumor. ¿Cuánto medía la eco? ¿Cuánto? No, 11, 11 centímetros. So the tumor, the measure of the tumor is 11 centimeters, huh? Retira de aquí. So the position is not easy. As you can see here, we need to play a little bit. So necesito cambiar la guía. Ok, yo voy a entrar más. Ya puedes cambiarlo. So I will change my guide wire. My guide wire is because of electrosurgical electrical sphincterotomy. We perform a damage. So you see the biliary tract here is completely occluded. I cannot see the biliary tract. I can see just the cystic duct. Olha aqui. Me das agua para limpiar aquí. Agua para limpiar. So I will clean a little bit. Dame. Okay, now. I am crossed with my other guide wire. So what can I do here is to try to continue cutting, but it's difficult because I have not a good position. The tumor is big. So what should be my strategy? First I want to have a security of my biliary tract here. If I cannot pass, I will try to see what on a spyglass what is happening, and try to go to the biliary tract. Okay, but if it's a complete occlusion, at that moment I will change. I will perform a hybrid treatment. It means I will do a treatment using the ERCP for decompress the pancreatic. Okay, un poquito más. I cannot have a good position with my maybe. Yes. Now I'm better. Now I'm better. Okay. I need to turn a little bit here. Now I have a good. Now I have a good cut. I would like to increase the cut before to continue. Now I think I am good. I will let my guide wire here. Okay, empuja la guía. I am not perfect, but I will let my guide wire here. So the yellow one is in the bile duct, and the white one is in the main pancreatic duct. So I will do a contrast in the pancreatic duct just to show you what do we have. And I will put an Archimedes stent in the pancreatic duct. I will use a pancreatic stent of 8 French, and the biodegradation of this stent is 12 weeks. 12 weeks. But you have different. One of the interesting of this is that you have different measures, and at the same time different kind of degradation. So from 6 days, you have a fast. 12 days. Yes, fast degradation is 20 days. Medium degradation 20 days, and slow is 11 weeks. Okay, understood. So you have three kind of degradation, and this is good. Why I choose um, slow degradation? It means 11 weeks, because until this patient start to have a response, so it's better. So I am retaking my position here. You can see it's not easier. It's position is very difficult. So I will pass. Quiero que me pases el finterótomo por aquí, just to show you how is the pancreatic duct. So then my second step is to cut better the sphincter, and try to pass a spyglass to see inside, to see what happened inside. So now I will do a contrast in the main pancreatic duct, and then to pass the stent. I will do a pancreatic dilation. Necesito un dilatador de 4. So remember, the guide wire, the white one is in the pancreatic duct. So now I will do a contrast. So now we are in the pancreatic duct. Now you see what is happening here. So the obstruction is here. You can see. So there is an obstruction in the neck of the pancreas. So I need to do a dilation and then to pass the stent. Okay, let's go. Empuja. There is a division pancreas also in this patient. I think this new technology is very interesting for the future. Overall, for treatment of structures, benign structures, and sometimes also to avoid pancreatitis when you perform a lot of manipulation or patient with increased risk of pancreatitis, probably to use these stents biodegradables, the faster one could have a good response. Okay, now I am good, but we need still more data. So new studies need to be developed. Okay, go ahead. Dilata. So we are doing a dilation. So the idea of the dilation is to facilitate the use of the stent. We have also 6 French stent, but uh, the only one that we have with a slow degradation is 8 French. So it's better to use the 8 French stent. You are okay. Okay, desinfla. Now after the dilatation, I will pass the stent. After the oncologist treatment, I think this patient will become better. So probably in some kind of tumors as this one, lymphoma, we can use these stents. In the future, I know that you will launch a metallic biodegradable stent. Unit B. Unity B. The name is Unity B. So it will launch in a few months, probably. I know that Dr. Teo in Hong Kong. Dr. Teo in Hong Kong, he used it. Yeah. Ese es el stand. Me parece que es pequeño. ¿No? No, del otro lado es. Ok, listo, está bien. Pero me parece que es corto. ¿Ah? Ese es el de 8 centímetros, 6. ¿Cuánto mide de largo? Ok, go ahead. So, I will pass the stent. The most important to me is to pass the stenosis. And to be sure to pass the stenosis and to decompress the main pancreatic duct. So don't forget to join us in ESGAE days. For all our subscribers, we will be show the new technologies developed here in Ecuador. That is artificial intelligence in US and cholangioscopy. Please don't forget it. So you see the stent here going out. The color of the stent is white, and I think we pass here. Probably will rest a little bit inside. But it's not a problem. What I need is that the stent drain well the main pancreatic duct. Okay. Now I think I am good now. So you can see. También. Okay, libera. Okay, so now the stent is here in place. It's draining. Correctly draining the main pancreatic duct. That is good. And now I will work better my biliary tract. Okay. Pásame el esfínterotomo, necesito cortarlo. So this is the Archimedes stent. And I think it's a very good indication for malignant tumors, lymphoma, because they respond very well after treatment. It's totally different to adenocarcinoma. Okay, photo. So now I will work in my biliary tract. I will enlarge the sphincterotomy. Then by now I can cut better. También el esfínterotomo. I will change the position to try to see if I So, what are my strategies with this case? I think I am good now. Okay, empuja. So, déjame inyectar. I don't know if my spyglass will pass, because I need to inject to see very well. Oh, I believe yes. Okay. So, spyglass. So my idea is to pass an spyglass to see what happened inside, and if I cannot arrive to pass, I will do an hybrid treatment. It means to make a drainage guided by EOS. So some of you can ask, can have a question regarding why to do an hybrid treatment. So we need to decompress this patient because if not, this patient cannot receive any therapy. So once we decompress the patient in the biliary tract especially, so at the end, if this patient have a good response, we can retire the axios if we use an axios or a fully covered stent for drainage, guided US, and then we can close. We can close the duodenal or gastric mucosa with an Ovesco, and to put a plastic stent to decompress more the biliary tract, and there will not we will not have the risk of fistula. So I think it's a good option also. So we can deal with that. I'm sorry, probably this patient will take a little bit time, but it is necessary to show you this new technology that is available already in some countries in Latin America. And second, how to deal with these cases. Hola. No sé si tenemos imagen del Spyglass. Ajá. Tenemos agua. Ajá. No, I think now we're inside the biliary tract. So you see, it is an external compression because of the tumor. But we can pass. Then. So we have external compression. You see? So the mucosa inside is going well. I'm sorry, I am talking alone. I believe this tumor is involved in here also. Look. Terrible situation, huh? Okay, let me see. So here. tract. So this is the biliary tract, huh? I believe, huh? Maybe 10. No, this is gallbladder. Okay, well, I am going out. I'm going out. Now I will try to see where is my biliary tract. Oh, there is. Let me see. No. It's a pass of contrast, so probably we can pass. And this is a good signal. Uh, now again. So again, I am in the cystic duct. I am trying to follow my... It's here. Here. Uh-huh. It's the same. What's this? Okay. So this is the cystic duct. I need to find where is my biliary tract, and it's very difficult. Oh, so maybe here. No, I think it's the same. The same mistake. Yeah. Already got glitter. Okay. Maybe here, huh? Maybe it's here. Okay. Maybe this is a video track. Yes. This is it. So you see, it is an external compression, so I didn't find the right way. Now I have the right way. Okay. Please push. There is a there is also an invasion of the tumor in the gallbladder. You see in the cystic duct. So I believe that I will use two stents here. So one, a fully covered stent for the biliary tract, and second, I will use another stent, biodegradable, but longer for biliary tract. You have for biliary tract. Ah, ¿cuál? Solo es de 8. Solo tienes de 8. No hay. That's okay. Yes, I will put one for for my gallbladder, and the second one I will use a metallic stent fully covered for the biliary tract. So with that, I think we will be okay. So this is a very nice case. I think we show a little bit how this kind of technologies can help us in difficult cases as this one. Si necesito el esfinterótomo con una guía. So how we will deal with this? I will pass first. ¿Tienes guía blanca? Dame otro esfinterótomo. No. So I will less guide wire in the gallbladder. So with that we will sure that the metallic stent doesn't perform cholecystitis in the future. There is a risk of 25%, and moreover there is a tumoral invasion. So I think in few weeks the patient will have good results with the bilirubin levels, and then can start the chemotherapy and probably radiotherapy. Okay, empuja. Pásala aquí. So I am exactly where I want to stay. No, I am in the very track. Okay, retira. Yes, I think I am good now. No, 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 no. There is a compression of the tumor compression. Now I am good. Okay, okay. I am good. So there is a combined compression. So there is a compression here in the biliary tract and in the cystic duct. So that's why I will use biodegradable stent in the biliary tract. Empuja. In the cystic duct also. Déjame entrar un poquito. Okay. Oh, it's okay. It's okay. We can let that. Okay. Okay, empuja. So why combine again? Also, we can use a plastic stent, yes, and we can return. But I think one of the advantage is the diameter of the stent is 8 French. So 11 weeks will be okay to have to start to have a response and to avoid an obstruction of the cystic duct. So and the main pancreatic duct. So now I will put 10 centimeters. That's it. 10 centímetros. 175. Oh, 17 centimeters. 70 millimeters. Sorry. Hablo. Necesito una prótesis de 8 centímetros totalmente cubierta. 10 por 8, sí. 10 milímetros por 8 centímetros. 10, 8 de largo. Eso, perfecto. So the radiopacity of the stent is very good. It's not bad. You can see the plastic stent, biodegradable plastic stent there. So I am passing now in the gallbladder tract. We saw in the cholangioscopy, we saw that invasion of the tumor in the cystic duct and the biliary tract. So who's just at the level of the where start the cystic duct. So now I am pushing the stent. Maybe I had to do a dilation before. So okay, I will try to push like that because I think should be very difficult. I think it's okay. I think it's okay. So now try to push a little bit more. Puja lagi ya. It's okay. I will let it stand there. I believe I am okay. Now I will pass a metallic stent fully covered. Yeah, listen. Okay, you can. Now I will deliver the other stent. Libera. Sí. Okay. Sigue. So the second stent biodegradable that I put it was moreover for avoid cholecystitis because we will have a double compression, one from the stent and the other one that already have because of the tumor. So this will help, and in 11 weeks we will have biodegradation. It's okay, perfect. Okay, perfect. So we finish. So we have a drain in the cystic duct a second in the main pancreatic duct with biodegradable stent and a fully covered metallic stent because after treatment this patient needs to relieve uh, needs to be good. Probably will be good. You see here, you see, this is tumor also, so chemotherapy is the first step for this patient and probably radiotherapy. So we finish now. Thank you so much for your attention and join us during ESGA days.